Nick Slenkovich, board-certified plastic surgeon in Denver. Want to talk today about the BBL, or Brazilian butt lift procedure. Is it a safe procedure? Lots of talk in the media now about the safety of this procedure, and even some advocating not performing this procedure or not having it done because of safety risks and even deaths. So let's get started. Got a lot to go through. I'm going to give you a presentation of where I see this. It's an important procedure in our practice, one that I feel is important to do safely. So before we freak out, is the BBL safe? I've given talks on this at national meetings in plastic surgery starting in 2018. In March of 2018, I gave a talk optimizing safety in gluteal fat grafting at the Mountain West Society of Plastic Surgeons. And then again, I was asked to present in May at the Mayo Clinic in Scottsdale at the Arizona Society of Plastic Surgery. And that was timely from the standpoint of, I've been very interested about safety ever since I heard about risks with this procedure, but also because the awareness among surgeons about risk factors for having deaths, having mortality from this procedure was becoming a bigger issue. And then later, subsequent to this, later in 2018, I think the media actually caught on to this and we're hearing more about it in the public. Let's get into it. Well, great, apparently facial fillers can make you go blind. Not optimal. Deaths from liposuction are too high, study shows. The study that showed this is from 2000. This is actually in our major plastic surgery journal. And now plastic surgery is a core part of every plastic surgeon's practice. We've changed how we do that procedure from a knowledge, scientific, and safety standpoint, adjusted medications, monitoring, and the way that procedure is performed. And no longer do you hear about safety factors in qualified plastic surgeons performing liposuction procedures. Getting a large booty isn't worth risking your life for. That's pretty scary. And this comes from a plastic surgeon, board certified, qualified plastic surgeon making this statement. I disagree with this statement, and I think it's actually not helpful to the discussion about how we perform this safely, and is this a procedure that you should have done. So we're going to go farther into it. I'm going to simply present one more statement. A headline from the news: woman walking across the street to catch a bus on the way to work is struck and killed. So truly, you can literally be struck by a bus on your way to work, or from any other things that might be risky, such as a plastic surgery treatment or procedure. And the key things are, okay, we know there's risk in the world. How do we prevent it? How do we optimize moving forward in this environment? August of 2018, the American Society of Plastic Surgery put out a press release. The press release issued an urgent warning, or updated the public about an urgent warning of the risks associated with fat grafting or the Brazilian butt lift procedure. They talked about a newly formed task force that had been formed in the past, reported on their findings, and urged discussion with patients, as well as provided recommendations for the safe performance of this procedure. They did not say this procedure should not be done. So I do want to be clear that there's not been a recommendation that this procedure be banned or not be done. And many of us as surgeons that practice this procedure, we believe in a very safe way and are very motivated to have safe procedures available for our patients, want to support it, want to get information out there about the safety of this procedure and how to do that. So the surgeon fat grafting has been a core part of plastic surgery for decades now. It's been largely a very, very safe procedure, and fat grafting to muscle makes a lot of sense because muscle has good blood supply. So just from a scientific perspective, we want to transfer fat, and we need that fat to get new blood supply from the area we've grafted it for it to survive. If we transplant or graft fat into muscle, muscle has good blood supply, it will give fat good blood supply and revascularize it. So many surgeons were trained in doing fat transfer to the buttocks, intentionally grafting into the muscle. We now know that that's dangerous. Recommendations and guidelines now are to avoid doing that. However, if we look at where we came from, in the 2000s, we started using smaller and smaller instruments in terms of size and using smaller and smaller syringes to give our injection techniques. often to the face, but if we use those smaller instruments in the buttock, they're not as controllable. They may bend and potentially go down deep, go down too deep within the muscle to where it can cause injury. And smaller syringes, if we're doing syringe technique or using mechanical pumps, can create high pressures, and higher pressures, smaller syringes are strongly felt to be more associated with the risk of causing that fat to go a place where we don't want it, get into the blood supply that causes that risk of mortality with fat grafting to the buttocks. So what's happening? Injury to the large vessels. We'll take a look at that in some diagrams, causing those vessels to allow fat to get up into the cardiovascular system, into the heart and lungs, and that can cause overwhelming clotting and even death from that. So recommendations, every effort now should be made to inject fat only in the subcutaneous layer. It's a different technique than was trained in the past. It is a technique that will avoid us getting into the risk of injuring the vessels down deep. Now, importantly, there is an excellent study done by the Aesthetic Society Research Foundation, that's our American Society of Aesthetic Plastic Surgery, that surveyed a number of surgeons worldwide and evaluated a total of over 200,000 cases and found out many risk factors, and as well as they had more than 24 deaths that were identified worldwide from this procedure. They looked at autopsies, talked to medical examiners, interviewed surgeons, a very in-depth study. 0 times have they found an autopsy where there was fat not deep within the deep vessels with damage to the deeper vessels in the gluteal region and down in the gluteal fossa. So it really backs up our feeling that that deep injection is absolutely the risk. We've never shown a mortality with injecting the subcutaneous layer alone. That's the summary takeaway point for educating surgeons, but I would share it also for patients to know that techniques can be very safe. And the key is, how do we have the education, knowledge, and training to know that we are safely injecting the subcutaneous layer? So here's a patient where we've done gluteal fat grafting, shaping things in, the framing of the buttock, getting that large, more curvy shape. Patients that are a bit thinner, same thing, allowing them to get some more projection where they started a bit flatter. Another patient here from the side showing those views. A patient with tummy tuck, where we've been able to not only treat excess skin, but also give more curvature. Another patient with tummy tuck, able to address the contour all the way around. So showing off the figure front and back and showing off sexy curves, including giving someone more of a booty where maybe they didn't start with much to begin with. And in patients that may be thinner, maybe have lost weight, this is a weight loss patient where I did do a body lift, which is a tummy tuck all the way around, also lifting the thighs and the buttock. Her before pictures here on the left, and after I've lifted the buttock, grafted the buttock, so where it was super flat to begin with, that allows us to add some more volume for some more curves. The World Association of Gluteal Surgeons was formed in 2019, formed by Dr. Salzauer, known as Dr. Miami, in Miami. And I'm a founding member of that. I'm helping write their protocols for the WAGS surgeons. We're committed to safety in this procedure, educating both surgeons and patients. We are open to new members. Currently, there's more than 100 members from more than 20 countries around the world. Over 100,000 successful BBLs have been performed, but we have a communication group where we're in close communication, sharing ideas and collaboration. And we have started a formal institutionally backed study to further evaluate our cases and add to the safety and science behind this procedure. Good, great 3D anatomy demonstration here. This is showing the female pelvic region here from the back, so obviously the buttock. Underneath, you can kind of see the fat layer. Or I control this here from my computer, so I'm gonna do that. If I remove this subcutaneous or the skin and subcutaneous layer underneath, we've got the gluteus maximus muscle and the gluteus medius muscle. So we want to inject just that subcutaneous layer above this, above the gluteus medius muscle, because below that is the gluteus medius and these deeper veins. So these deeper veins go above and below the piriformis muscle, but just underneath that gluteus maximus muscle is the layer where these deeper veins lie. And so that's where we've got to avoid going down in deep. If we want to look and see what the issues are, let me strip away a few more muscles. strip away a little bit more of the anatomy here and turn around to the front. All right, zooming in. This area here comes right from those deep gluteal veins, and it goes straight up into the iliac system. The common iliac system goes right up into the vena cava, which goes straight up to the heart. From the heart, it can clog the heart if you get fat into that system, or it can go out to the lungs and cause blockage of the lungs. So straight shot up, low pressure system. We want to avoid ejecting that region.